Before embarking on your journey towards a straighter smile, it's important to understand some essential aspects of aligner treatment. Your dentist has recommended aligners for you, and we want to ensure we achieve the best possible results together. Let's cover some important points now, and please don't hesitate to ask a team member if you need any help or clarification. Aligners are clear plastic trays that are removable and designed to move your teeth gradually over time. The number of aligners you'll require varies based on your individual needs, and we have tailored your aligners to address your specific concerns. Each aligner is numbered and must be worn according to your dentist's instructions before moving on to the next in the series. To achieve optimal results, wearing your aligners for at least 22 hours per day or as directed by your dentist is essential. Failure to follow the recommended wearing schedule could delay your treatment progress. You should remove your aligners when eating and drinking, as failure to do so could damage your aligners and teeth. However, it's okay to drink plain water while wearing your aligners. If your treatment plan requires it, your dentist may need to place small, tooth-colored attachments or buttons on your teeth to aid tooth movement. Your dentist will remove these once your treatment is complete. If your attachments break, it's important to contact your practice immediately. Sometimes, attachments can rub against the inside of your lips or cheeks, causing small abrasions. Wearing your aligners will help prevent this from happening. To avoid any marks or damage to your teeth, brushing your teeth carefully is vital. We recommend brushing 3 times a day with fluoride toothpaste. You can brush all your teeth and attachments as usual. It is important to go back over each attachment individually, angling the toothbrush above and below them to remove any food or debris. Cleaning the areas close to your gums is also important, as food can get trapped there. Using interdental brushes can help clean out any food or debris caught between your teeth. Your dentist may provide a small roll of soft, spongy, plastic-like material to chew on, which can improve the fit of your aligners and may help your treatment progress faster. It's normal for your teeth to feel a little loose or wobbly during treatment, but don't worry. This is expected and will settle after your treatment is complete. Taking care of your aligners and teeth is crucial to avoid any issues during treatment. Missed appointments can also delay completing your treatment, so please ensure you attend all scheduled visits. If you play contact sports, you must let your dentist know, as a special gum shield may be necessary. Finally, make sure to bring your aligner box with you to every dental visit. If you need any further information, help, or advice, please don't hesitate to contact our practice. Thank you for choosing aligners to help you achieve a straighter, healthier smile.